I've gone from ward work to A&E department. So
Sorry if I stop. Now you know, like look, I've been working with you, and what like attracted me of you was like you're not just there to do what you're supposed to do, your job, but you're very um, you're very helpful. You're an excellent team players. I saw you like doing jobs around, helping moving the bed, even if at that moment you're not busy or that's what I like of you. You're very multitasking and an excellent team player. I want to ask you. Obviously, as a mental health support worker, you go support by a band 5 mental health nurses. Sometimes I think you don't need to be a nurse to do that job, if you know what I mean. Like, I don't know. When I was in Brighton, I used to work in Brighton General Hospital, and I never seen like a mental health support nurses. Most of the one-to-one or dealing with patient mental health issues, they were like the ACA.
I think what it is that maybe it's the area. London's bigger than Brighton numbers, and also the amount of people that. Well, I think basically why these roles have come up is because there's been so many deaths in A&E.
You think so?
100%. Like people. See, mental A&E's a busy place. Nurses have got to deal with Mr. Jones with chest infection, Mrs. So mental health patients get sort of get left. So this is why these roles have come up. So this is why we're dealing with the mental health patients. It frees up the nurses to do their other roles.
Yeah, the reason I'm telling you that is because you don't need 3 years university to be a nurse in order to do one-to-one for patient, to look after patient.
No.
Yeah, don't you think it's like a waste of taxpayer money? Somebody do 3 years university, just go there, do one-to-one with patient. Don't you think it's like
yeah, they could give it like a band 4, for example. I think that's what they're trying to do now. They're trying to get band 4s. It's like band 4s couldn't give medication before, but now if you do the test, you can give medication. But so you're basically a band 4 that can prescribe medication. Sorry, give medication. So you're basically doing a nurse's job, but they're paying you a band 4 wage. Do you know what I mean? That's basically what's happening. So they're trying to lower the grade, lower the banding. So basically get a band 4 to do basically a nurse's job, but paying band 4, because as you say, nurses are band 5, band 6, whatever, do you know?
I mean, I understand it, but I just didn't see, obviously I don't have the skill to literally give my opinion professional and everything, but I don't think there's literally the need to put a band 5 to do that job. You know what I mean?
The NHS, there's lots of things that I don't understand with it, do you know what I mean? That's why it's hemorrhaging money the way that it does, do you know? So
yeah, I think it's there, yeah. Wow, I mean, it's just, yeah, I mean, NHS, obviously there is time for improving. Obviously, it's not a perfect institution, NHS, it can always be improved and everything,